Well, hey everybody, it's Sandy, and welcome back to my channel dedicated to helping you advocate for your own health, one topic at a time. Same topic though, okay? It seems like there's no topic out there right now except for COVID-19, the novel coronavirus. And so I am going to talk a little bit about what I'm doing now in, I don't know, day whatever in my confinement. My husband and I are staying home. And I want to talk a little bit about what we've just starting to read about the drug hydroxychloroquine and, that the reports that it seems like a promising option for patients who are infected with COVID-19. And then I will also briefly mention my opinion about some of the warnings that you've seen out there about whether to take anti-inflammatories at this time. But before that, I'm just going to get right back on my soapbox about two things. One, I mentioned at the end of my last video, and I was so happy that like later that day that the CDC announced some new guidelines, because I was saying I think we are going to have a more robust response to this thing. I don't think it's about just washing your hands. Obviously, you have to wash your hands really well and thoroughly, but the COVID-19 virus is just extremely contagious. It's I hear people say things like, well, we lose so many people to the flu every year, and that's a totally different equation. Okay, we don't have more people than our facilities can handle, all putting the same strain on the resources all at the same time with flu pandemics. And I think it's because there's two reasons I've read. I don't know if anybody knows for sure, but one is this COVID-19 is much more contagious than most other infectious diseases that we've had to deal with. So I think we're like the flu. They said something like, if you get the flu, that by the end of a week, you'll have infected, I remember, somewhere between 5 and 10 people. Let's say they said 5 or 7, maybe 9. That with the coronavirus, it's 45. Okay. I've also seen a statistic that if like one less person gets COVID-19 at the end of a month, that translates to 1,000 less people. So it's just highly contagious. And then on top of that, I've read an explanation also by a microbiologist who said that we don't have any immunity to this. So the flu, when you have flu epidemics that go around, even if you didn't get your flu shot, or even if the flu shot, they got the strains wrong that year, or they weren't real accurate. As a human race, we have some resistance to the flu. We have some immunity to the flu because all of these different strains are still influenzas. But the COVID-19 is novel, as they say, the novel coronavirus. So the human race doesn't have any immunity to it at all. And that's why we're seeing what we're seeing. So I'm going to stand by what I said before. I'm glad that the CDC has changed its guidelines and that they're even stricter than they were before. Guidelines aren't rules. I really hope that more and more people will do this, because it's going to be the only way for us to tackle this is together, or else we're going to have to do something more robust. And I'm not ruling that out. I don't want to be, I'm not a doomsday prepper or anything, and I don't like to scare people, but I do think the be prepared is a very good way to approach this, because I think it is possible that we are still going to have to do something more robust. We are seeing some states now that have pretty much, stay in your house curfew, you're staying home. So I personally, my own personal opinion, I kind of wish we would do that as much as it would hurt, because of that. There's this saying, pay now or pay more. I'd rather just really hit it hard now, rather than drag it out. But I'm one person, and there's all kinds of reasons not to do that. So that's my issue one with the soapbox. The other issue I want to just reiterate that I think I said in my last video, and maybe I'm just going to say every time, is I think that we have overfocused quite a bit on mortality as though it's the only negative outcome with this disease. Okay, so and whereas lots of young people are probably going to get this and be okay, and if we did surveillance testing, which we're not, I think we would find that a huge number of young people have this and don't even know it, and they are carrying it and spreading it. And then we juxtapose that against, the elderly population, which is at very much risk because, the mortality definitely skews elderly. Okay, so you just have a much greater chance of mortality if you are advanced in age or have some very serious health conditions. But there are still a lot of people in between there, okay? There are lots of people on ventilators from this disease in Italy. Say one infectious disease doctor that I heard interviewed said the average age in the intensive care unit was like 65, or the mean age. So half the people in there on ventilators were under 65. There was probably a bell curve, okay? So 65 was the top of the bell curve. They went up to, I guess, 80. And, because I think Italy has these rules now where people aren't being, they're not getting a ventilator if they're over 80. I don't even want to talk about that. But we are seeing protracted illness in people who are middle-aged and even some young people. And even though they're not likely to die when they're young, just having gone through that, they are going to have a lengthy recovery. It's going to be a very expensive hospital stay. They are going to likely have some residual. I don't know that we know yet. I would be very surprised if we don't find that a lot of people don't make a full recovery. People can leave this kind of stuff behind them, but have some residual respiratory issues. I suspect we're going to hear some about that later, but I just don't think we ought to ignore the middle. Okay, so the high mortality risk over here versus the completely asymptomatic carriers over here, which I think we're not focused enough on those people either. But that doesn't mean that some in between, that people who are younger or middle-aged who do happen to be very symptomatic and have respiratory distress, and those people might have a very long, protracted convalescence. Okay, if you look at those numbers that come out all the time where they show the number of cases tested positive, number of confirmed cases, number recovered, there's a huge difference there. And that tells me that, first of all, not everybody has committed yet to the mortality number or the cured. So this might take a very long time to heal from. So that said, I just wanted to really talk briefly about the hydroxychloroquine, which is that, in case anybody doesn't know, it's the generic name for Plaquenil. A lot of people in this country know it as Plaquenil, and many people take Plaquenil, hydroxychloroquine, for the autoimmune connective tissue diseases like lupus and rheumatoid arthritis. Those patients take it for many years. They take a dose that's a little lower than the one I saw in I don't want to even call it a study because it was just such a small little group of people that was studied, but that group where they tried it, I think it was in a university in France. But it depends on your weight. They just gave everybody 600 milligrams. I think the patients who take it for autoimmune disease take something like 5 per kilo. So an average man is about 70 kilos, so that'd be like 350. So they were giving 600 for this, for the COVID-19. And, it was a very small study. I do respect what I hear coming out of Washington, where they're saying, well, it's very small, it's anecdotal, it's not been peer reviewed, it was not double blinded, so there weren't patients getting one or the other of something and not knowing whether they got a placebo or the drug. And the same thing, the practitioners weren't blind either. They either gave this drug or they didn't give it. So no one was blind to it. And all those things indict, making a statement that this helps. Okay, we don't really know that it helps, but I'll say that I think it sounds very promising. And given the dire situation we see with this pandemic, hydroxychloroquine has been around a really long time. And what we always do in medicine is a risk-benefit assessment. We sort of weigh things like this, is it going to help? Is it going to hurt? Which risk are we going to take? And, we do keep patients on hydroxychloroquine for many years, like upwards of 20 years. And the dangers of hydroxychloroquine apparently come with cumulative dose. So it's not about the dose you're on today, whether you're on a high dose or a low dose. The risks of like retinal toxicity, for example, in the eyes, has to do with a cumulative dose that you're on at the end of, X number of years. So a high dose, long time. So, now is it possible that in the setting of this disease that we might find that it has some effects that we don't like? Yeah, I guess that's possible, sure. But I sure don't like the results of this disease either. So I kind of resent when we, again, won't tolerate any nuance and we just say we just throw something away because it's not pure science. I think in situations like this, all we really have are the soldiers out in the field who are fighting this thing, and somebody notices something. Maybe somebody noticed that people who were on this drug did better. I don't know what spawned the idea here to try this out, but that's all science ever studies anyway, is something someone's noticed, or somebody has a hunch and somebody thinks this, and then they might do some kind of an early, small trial, and then they do larger trials. And if we are just going to insist on waiting until we have, long-term, double-blinded, peer-reviewed studies, we might lose a lot of people, rather than give them this, what's we know so far as a very safe drug that we have readily available, that's cheap, and most people tolerate well. So just for a synopsis, in this study, what they did is they took 36 patients who were all diagnosed COVID-19. Okay, they were all positive, and 16 of them didn't get anything, they didn't get this drug, and 20 of them got the hydroxychloroquine 600 milligrams a day. I believe it was 600. And some of them also got a Z-Pak, which is azithromycin. It's an antibiotic, which I suppose that was only used when they thought there was an indication for it. So sometimes they might believe that there's, on top of the viral infection, that there's some maybe bacterial pneumonia going on. So some people got it. And what they found is in the group that didn't get any hydroxychloroquine, after 7 days, something like only 12% of them had fully recovered, because we know this takes more than 7 days if you're going to recover at all. And then the group that got the hydroxychloroquine, I've heard 70 and I've heard 85, and I'm going to try to link literature below. I think it's 70% of them were completely virus-free on tests, so they were not shedding any virus and considered cured. And then the people who had the azithromycin got to that point in 6 days, the azithromycin plus the hydroxychloroquine. So, my take home is, I hope I'm never in this position, but if I have to advocate for somebody that I love, or for myself, or I'm telling people that I love, if they have to advocate for me, yeah, I want the hydroxychloroquine like right now. So that'll be what I'm doing. And then briefly, I just want to mention that everybody's heard that there's, been these reports, is it safe to take the Nsaids, we call them, the nonsteroidal anti-inflammatory drugs like Advil, ibuprofen, things like that. And, I was a little disappointed with some of the response to that too. So it was just anecdotal. It was like a tweet that a French doctor put out, or somebody at the health ministry. But again, somebody notices something. That's all we have right now. Somebody notices that they've had some kids like 20-something years old on ventilators, or having particularly vehement response with this infection, out of sync with their age group. And maybe this person noticed, well, there's some of these people have been taking the anti-inflammatories. So I don't know, it's far from settled. Okay. And I don't know if that's ever going to get settled, because it's probably not even a priority right at this moment to study. But, again, I do this risk-benefit assessment here, and I think to myself, who really needs to take Advil? Seriously? I mean, I don't need to take Advil. I might want to take Advil if I have a headache or something, or, something's swollen, but I don't need it. And I think in light of the fact that somebody who's out there in the field trying to do what's best for humanity says that they might have noticed this and seen, just anecdotally have this hunch that this might be worth thinking about here. As far as I'm concerned, I'm not taking any Advil right now. Okay, I'm not going to take any of these things. I think saying we don't know if it's safe is a whole lot different than saying, well, we don't know if it's not safe. Okay, we don't know if it's not safe, and it's never completely necessary. So this is my take. I know this was really blunt and, to the point, but that's sort of where I'm at these days with this kind of thing. Other than that, as far as what I'm doing, I'm trying to settle in for the long haul and dial my expectations so that I'm not really disappointed or surprised, and trying to calm down. I'd really like if you guys would write in the comments, I'd like to hear what you guys are doing, especially those of you staying home. What are you doing with your time? I have found I've been able to renew an old hobby I had. I've in the past, I liked crafting with miniatures. When I was like a teenager, I had a really nice dollhouse that I crafted all myself and stuff. And I've kind of had one fall in my lap I hadn't had a dollhouse in like 30 something years. And once somebody was getting rid of one a while back and I took it. And so I've started working on that. And I find that it's very quiet, very focused, and it takes long chunks of time to work on it. And it's a nice feeling as you go. So my brother-in-law, I was talking to him last week, and he was saying that gardening is a really great idea if you live somewhere where obviously the weather permits, the conditions are good for it. And I think that sounded like such an awesome idea. Unfortunately, I really ought to be kept away from plants because plants are in my care don't tend to do very well. So I think the plants will thank me if I kind of stay out of the yard right now, but that did sound like a really good idea for people who are into gardening. I think it's really therapeutic, and you're outside in the sun, keeping your vitamin D up because we're all indoors so much now. But I'd really like to hear what you guys have to say and suggestions about what else you guys might like to hear about. I am going to make a prediction that we're going to have to get tougher yet. And I hope we do. I hope we all band together, and I hope everybody stays safe. Thank you for listening. I really would like to hear you interact with me. And till next time, bye-bye.